We are very happy to have with us two guests today, Alicia Puyana and Lilia Garcia Manrique. Uh, we are particularly thankful to both of them for having joined us from Mexico, where it's 7 a.m. in the morning, and we've really woken them up to and got them to join us early in the morning. So thank you very much. Welcome to our lecture series. It's a great pleasure to have you both with us. Alicia is an economist at Latin American Faculty of Social Sciences in Mexico. She's been visiting professor in Oxford, at LSE, at El Colegio de Mexico. She's worked in Colombia at both the National University of Colombia, and she's been director of the Regional Center for Third World Studies in Colombia. Alicia has been a friend for a long time and has been part of Ideas Network. She is been for many of us outside Latin America the person to go to for anything on Mexican economy. She's an expert on the impact of globalization and structural adjustment on Mexico's economy, on its agriculture, on various other aspects of economy, including the oil economy in Mexico, in fact. So, welcome, Alicia. Thank you for joining us. We are also joined today by Lilia Garcia Manrique, who's a PhD student at University of Sussex. She's been also previously at Latin American Faculty of Social Sciences, where she's worked with Alicia. She's worked on NAFTA, on globalization, financial sector, on oil prices, and I understand on natural resources and on power sector and issues related to corruption in Mexico. Thank you very much for joining us and welcome.
Thank you very much. I am very glad and very pleased to participate in this series of conferences talking about the pandemics and how that tragedy has inflicted harm and pain in so broad sectors of Latin American society as elsewhere. I would like to call the attention first about the special situation and a very particular situation that is confronting Mexico since the political tsunami that erupted due to the results of the 2018 1st of July elections. It was a landslide win for Andrés Manuel López Obrador, who has been fighting for political restructuring of the country, at least during the last 30 years. Well, he found it is really a regime change phenomena, and the new political apparatus found the economy in ruins after 25, almost 30 years of almost non-economic growth, deepening inequality, and poverty just about at the same level as before. No, a worsening of poverty sometimes, and a mild recovery after 20 years in the last 10 years or so, but rather mild recovery. So the new government started a crisis and counter-crisis economic program. He named it as moral economics, and which is not religious, although he is a deeply religious man. But the thrust of the main axis of the morality of his program is to reduce eliminate poverty, reduce inequality, and change the moral of the society, fighting corruption, fighting the crisis in the political system, the crisis in the economic system, and in the judiciary. So I could suggest Lilia will mend my or disagree with that, or rather explain much more that he started a anti-crisis economic program, fighting very deeply corruption, found millions or trillions of pesos of corruption and so on. And he thinks that with fighting corruption, living with a modest government, he says that it is not possible for a poor country, a poor society as Mexico is, to have an imperial government. Very expensive, living in luxury, especially the very top public of servants and so on, and politicians and people on the private sector. Those are the elements, and he changed quite a lot of the orientation of the budget, and especially who is the actor in political reform, in the budget, in political and economic decisions. So that is the general atmosphere. When the crisis erupted, well, the situation was still very, very bad. Economic growth almost non-existent, and the distribution programs were institutionalized since the very beginning. But in 1 year and a half, it is not much more what can be done, because all the economic power and the main traditional political elite has been fighting against him by all the means since the very beginning. They saw the pandemic as a way to forcing Andrés Manuel and his government to change the orientation. But he did not, or he does not. And that is the question and the political turmoil now. Many of the criticisms are rooted in that situation. Okay, the following.
So our main approach is that this pandemic has been a shock to everyone. Mainly it's a problem of uncertainty. We really don't know what's going to happen, how things are going to go, how things will be after this. Even like the mathematical models that they are dealing with, explaining the pandemic, they are not very clear. There are a lot of uncertainties in them. So in terms of social impact, we can probably be knowing what's going to be in the very short run, the main outcome of this pandemic, but in the long run it's going to be very hard. Not to mention that there is going to be an hysteresis in most of scenarios. That means that once there's this shock comes, it's going to be pervasive through generations. So there's going to be this like stigma of what happened here, unless there are like really good public measures here that could alleviate this problem. So mainly this configuration of the modern world, where we are like taking appropriation of wild spaces with like air traffic, like a very busy air traffic, chronic underfunded public health, marginalization of elderly, structure, ethnic and gender discrimination, fragile supply chains, and problems with political parties definitely lead to this scenario. And in these societies, well, humans, natural resources, and environment are just commodities, and this comes like more clear in this kind of crisis. So,
Okay, the following.
so what we know? So the only thing that we can know for sure is how we are trying to measure it. So it's the case fatality rate. The case fatality rate is like the total rates divided by total cases, and it definitely depends on the number of tests that every country is doing. And deaths are driven by the spread of ages, prevalence of existing illness, how people live from hospitals, and how well equipped are hospitals.
I would like to add something, can I?
Yes, of course.
That even though we have to have in mind as well that after some pandemics that we or epidemics Mexico experienced in the last 25 years, the system of developing the models to predict the spread and advise policies were in place. Although within the secretary or within the universities and so on, they had already that know-how, how to deal, how to handle, that they did immediately at the beginning of January, started to design the policy responses.
Yes, indeed. And I think there have been some scenarios here analyzed, saying that some countries in the some developing countries have had like more assemble this reaction to crisis, to pandemics. And I think that like probably the case for Mexico that was one of them, given that in 2009 we had like this a pandemic as well in of a flu kind of pandemic. Anyway, so the thing is like this crisis of course increased the vulnerability of people that were already living at the margin or have been like systematically neglected, like indigenous people, for example.
Okay.
So in the scenario in Mexico, so as Alicia had mentioned it at the beginning, the health system has been like very has been underfunded for several years. So, for example, there have been like people that had access to 3 health insurances, depending on how the work scheme of the worker is classified, and this creates like a high inequality because there are people having 3 health insurances, and then there's someone that living in or laboring in informal societies, so they have no access to any health insurance at all. So the Mexican Health Society is one of the latest safety nets of a now depleted welfare state that began like around 1945. It was established around that time, but now it has been like severely diminished. And in the society, in this health system, there have been numerous scams within the private sector. For example, non-working chemotherapies, and very recently on existing and overpriced medical protective equipment. But it's still, in relative terms, Mexican health system is better than other in Latin America, like Argentina and Uruguay.
I would like to add something that in the revolution in the 1910 to 1917, one of the pillars of the social pact was health system. The second, education, and the third, land reform, and fourth, political insertion of popular masses. So after as Lilia said, the deepening of that social pact was in the 40s, after the Second World War, and up to the 82, when the debt crisis erupted. They introduced in the health system, as well in the education system, market orientation reforms that had depleted, especially health system.
Right. So for Mexico, in numbers, the pandemic, the first case confirmed was the 28th of February. For the 4th of May, that's some days ago, 66 days after the 28th, the first case, we had 24 confirmed cases, 25,000 confirmed cases. That's like 185 confirmed cases per million. And compared with other countries, for example, US, Spain, Italy, and UK is lower. Still is higher than, for example, China and India, that they have like 60 and 31 correspondingly. So according to how this look in the very now famous curve of spread of the disease, since the first day of the confirmed case, so Mexico is growing in a lower rate, for example, than India or than UK and the United States. And in the case of how good they are doing about flattening the curve, Mexico is still like reaching the peak. So hopefully they will at some point they will begin flattening it. As you can see, like United Kingdom and United States, they are already there flattening, and India as well. It's like trying to flatten the curve. Of course, these two graphs, they are from this research center in Oxford called Our World in Data, and both of them are very explicit, saying that this data depends on the number of tests that they are doing in each country.
The model is called Centinela. There are so many different models to count for the diseases, infectious, and so on. That it is one of the models that was developed here in Mexico and there has been shared by different countries. There are so many that sometimes numbers are very difficult to compare.
Definitely. So how does it look like? Well, in Mexico City, that's the biggest, most dense populated state in Mexico. We have areas, municipalities, let's call it them, that are very well equipped. For example, not very well, but better equipped. For example, Iztapalapa, they have 197 clinics per 1,000 number of people, compared with Coajimalpa, for example. No, I'm sorry, this is per million. So it's like 197 per million, and then we have like Coajimalpa, it's like 2,400 per million. So it's
Iztapalapa is the poorest area of Mexico City and one of the most dense populated.
Yeah, yes, indeed. So we have like a big gap between one area and another area, and it's somehow reflects in the numbers. These ones that are like less equipped, some report the lowest cases, but this is, as Alicia has mentioned it before, is like kind of a systemic problem from early years.
I think that it is a very good picture of the whole country, that divergence, that disparity between areas and regions.
Well, as we have mentioned before, one of the main problems with this crisis is that the most vulnerable people are, of course, the most vulnerable as well in terms of in morbidity to the pandemic. So in Mexico, how does it look like? Well, 42% of the population lives in poverty. 7% of the population lives in extreme poverty. 29% doesn't have access to products of basic needs like health, education, and like good nutrition. 37 don't have enough income to buy a basic nutrition basket, and 56 out of 100 workers are in the formal sector, and this is for 2018. 2019, sorry. Okay, so the economics response to this pandemic, in case for Mexico, he has AMLO, Andrés Manuel López Obrador, has strongly opposed to get debt, to increase debt in real terms, and he's keeping the actual proportion in budget. This decision contrasts with other countries, for example, our north neighbors, US, and this is because Andrés Manuel has been talking about the disparity in capital accumulation that is driving the big proportion of inequality in Mexico. So the owners of big capitals will be getting most of these fiscal budget responses if he opted for debt. So that's why he is opting to not get any debt. On the other hand, we have the small and medium entrepreneurs, and they have they provide 52% of GDP, and they employed around 72% of the working population. For them, the response has been not as well as we have like wanting to, because they have only have granted like a $400 credit, and it will be effective all just until this month. So probably they since they are in this scenario, they are also small enterprises. They may be also struggling since mid-March or since April, but they will not get any funds until May. And as we have mentioned before, this austerity in the budget is reoriented to help the poorest one, and not the richest at the top.
I would like to add something that within that universe of small, medium enterprises, the bulk of it are minimum enterprises with no more than 5 company or enterprises. And those are the ones that are receiving the support of the government now. For them to, the idea is, rather than giving capital, is first of all to pay for them to keep workers on.
Mm-hmm. Okay. So for the health system again, so as we've seen in the table before, the lowest rate of positive case usually is correlated with low clinic capacity. And as Alicia has mentioned before, we're doing this Centinela sampling of cases as suggested by the WHO. And in this, the main factor that it's important to analyze is the factor, the expansion factor. This will suggest or will give you a light of how many cases are per one contagious. So it has been calculated in Mexico is 8, although some other calculations are around 12. The average is 8. This is very variant, and this depends mainly on the number of the capacity of the health system, the tests, and as we have seen before. So this depends a lot of the infrastructure of the health system.
Since the Mexican system has not the capabilities of doing universal testing, they replace it by permanent communication with whatever person calls to 3 or 4 systems, different systems. They make questions, about 15 questions, and analyze how big is the risks for you to get infected. And they offer, if we want, or the person wants, to call them every day to check. And that is going on because my daughter did that and I did as well. And whatever the mildest symptom appears, you can call. They cannot make testing, full testing for all the people. They start testing only the ones that have serious or more serious symptoms and ask them to go immediately to the hospital. Right. It's quite, I think, efficient system so far. We don't know tomorrow what will happen.
And yeah, so in terms of how much investment has this the health system has received, so since 2010, there has been an increase in total budget for the main social security system. That's the Mexican Institute of Social Security. It went from 45% to 48% in this year, 2020. But there are other health institutes that are for those that they are not in the formal security system. That as we have seen before, there are a lot of people not in the security system. So these institutions had a reduction in 2010 from 23% to 19% in 2020. Now the biggest problem is that this increase, or in some scenarios for the budget, has not taken into account the increase in population. So we are talking that in expenditure per capita, there has been a real decrease in this budget allocation. So it has come from 2.8 in 2010 to 2.5 in 2020 this year. Now the biggest problem is that we have never had reached the 5% expenditure in health system that we should be, or like mostly will cover like sufficiently most of the Mexican health needs. So for example, in this government, they are proposing the Health Institute for Welfare, and it will be open for everyone. It will be for people outside the formal security system, but still, if we don't have enough funds, this kind of good ideas will not be well funded and cannot be worked appropriately.
The long-term objective of the program is to make a system like the national health system before Thatcher, something that is very idealistic, utopia, if you wish, but it is the aim.
Right. So how did they prevent it contagious? Well, the 14th of March, as we have said, the first case reported was the 28th of February. The 14th, the educational minister announced suspension of elementary schools and secondary schools effective from the 20th of March. And but by that day already, some universities and some workers had already stopped working in place, and they have moved back home, doing home office and virtual lectures. So this was only 16 days after the first confirmed case of coronavirus. Way shorter than, for example, here in UK, right? So one of these public measures that they create was this big campaign of letting know, like, all of the people, all the population, that how this evolved, and to answer questions. So one of the first measures was to have a daily conference dictated by the health deputy minister, that's Hugo Lopez Gatell. It's a person that has experience dealing with the flu pandemic in 2009 in Mexico, and he has been very open to questions and answering openly, and they are making these campaigns. In this case scenario, this is this picture of this cartoon here is a woman that it's suggesting that you should take at least 1.5 meters from your surrounding, so any surrounding person, so you can avoid like getting the virus.
It has been very effective. Su is your, and Sana, healthy. Susana, your healthy distance, at least 2 meters distance. And now it is applied for children, with cartoons for all ages, all maladies, the obese, diabetics, or with heart problems. And it has been, I think, efficient because everybody understood what keeping distance or social distancing means.
Yes, indeed. It's very clear for everyone. So the comorbidity for the coronavirus, that's for the 30th of April, as reported by the Deputy Health Minister, most of the cases are related with hypertension, diabetes, and overweight. And as in global states statistics, men are more propense than women. In this case scenario, this comorbidity is a big problem for Mexico because we have one of the highest rates of overweight, as well and we have a predisposition for diabetes and also as well for hypertension. So this is a big problem for the Mexican society. Part of reducing the vulnerability of people is to alleviate the poverty in them. Obesity and underfunded, any problem with health system can be mildly alleviated with more resources, more economic resources. So that's what also Alicia has pointed out, the importance of these social programs run by López Obrador. So he has been running these unconditional transfer programs to somehow leverage the unequal Mexican society. And the social expenditure is around now, it's 10% of the GDP. And there was an increase of 2.8 compared with the year before, this year, 2020. And just after 10 months of the new administration, there was 20 million receiving a government support. That is 5 out of 10 households, many in the informal sector, of course. And the total reach of the program has increased the total welfare of the poor ones. But still, I mean, there's a big year-long unequal problem that this administration is fighting. So as we had mentioned before, he has opposed to increase debt in real terms, and I think this is duplicated. Okay. So precisely for the COVID responses or social transfers, Oxfam has made this analysis, and right now only 40% of people are receiving living in poverty. Only 40% of people living in poverty are receiving some kind of transfers or direct transfers. These transfers, or these social programs, as Alicia mentioned it before, has been now institutionalized. That's it. They are like legally on the Constitution. So these are programs that will keep going even like with new governments. So we're talking about in this graph we can see that most of the beneficiaries ones are like young people or like old people, like above 70. But as we see, there's still a big gap between people from 20 years old until like around 59 years old. So most of them are active workers mainly. There's still a big gap to go. And let's see. Okay, so in how these people that they are not they're in poor situation, they don't have enough resources. What is like what's going to happen after this big shock, because in one hand we have people that are losing their work, and there are people like at the top 10% of the income distribution that they are like receiving like all their benefits and still are able to save. So there is going to be a big disproportion of the after pandemic, and this can be a big problem that can increase inequality. So, for example, to give a snapshot of what's going on, the average income of Mexico it's $316 per month, and to be considered middle class, $600 is the income, but the top richest are earning around like $33,000 per month. So it's a big disproportion. So even people living considered at middle class, that's it, like $600 per month. These workers, some of them are still living paycheck to paycheck. And so our biggest concern is that these top earners that earn $33,000 per month will achieve something called voting with your feet. That means that the one that has the income or the power, the money to buy, they will be reconfiguring the after pandemic scenario in Mexico. So this will, as we have mentioned before, will increase the inequality in Mexico. Yes.
Well, I think that those direct transferences are different to the unconditional transferences before, because first it means that no intermediaries will be, either in the public sector, like special programs and so, or in the private sector. They receive the money directly, but those are, many are linked either to working programs, and so something like in India, rural work, and study, millions and millions of scholarship, and apprentices in the factories, urban factories, to be after that permanent workers. That is a difference, deep difference between with the conditional transfer or conditional transfer before in the previous systems. Right. That it is not only money transferences, but job creating opportunities.
Right.
And the target is all on poverty to be covered by the end of the sexennium.
Yeah. So as we have said, like centuries of consumption patterns have dictated the main response, the most often ones. So it's not clear if this pandemic will change it. Probably will not, or it will increase the inequality. And it's the inequality in Mexico is pervasive, even though this new government is trying to change this. So, for example, very lately in the legislators have been trying to establish the universal basic income scheme, targeting, of course, mainly poor ones. But still, they're still missing some actions, like a more progressive tax system and a higher tax scheme for the richest one. And although they're having some steps in this area, such as eliminating exemptions, reductions, rebates in income taxes, and increased effective taxes by 3% of GDP. It's very appropriate to mention that Mexico has one of the lowest taxes revenues in Latin American, and
effective taxation.
Yeah, one of the lowest. So there have been some mentions that AMLO is Andrés Manuel, as we had, it's compared to Trump and Bolsonaro. Well, this has been mainly because he has had some colloquial mentions during his daily program that he runs on a daily basis. And it can be these declarations were like kind of misinformative, and these were like as well misinterpreted for political interest. But still, the government rely highly on the scientific knowledge of the deputy minister and as well as the health the minister as well, the health minister. And that's exactly why this late evening conference on a daily basis has been run, because in order to dissipate this kind of doubts. So compared with other countries, for example, US, UK, or Brazil, even India, our response has been more timely, reducing the bigger impact of contagious.
I would like to add that those colloquial declarations are hated by academics, intellectuals, and some professors and so on, but normal people doesn't care very much about it. Rather, they like it.
Right.
At least they understand better than we do.
So, of course, like as we have mentioned in this presentation, the main pillars of Andres Manuel has been fighting poverty. Now, in this case, of course, also corruption, as Alicia mentioned at the beginning of the presentation. So, some of these expressions or like actions that could have confused the people were, for example, not stopping his daily tours around the country, or having lunch in small shops, and like some kind of mentions like this may have been confusing, but still he has been relying on the health deputy, and there has been an overall acceptance high and recuperated few points, an acceptance rate of his mandate. In contrast, of course, like Trump is trying to keep the spot on him all the time, and he's giving like these uninformed declarations of risky situations like bleach intake. And of course, for example, here at UK or in US, the responses has been mainly to protect the economy, and this has had a very high price to the debt rate in these countries. And in Mexico, this has not been the case scenario. They have cared more for people. So Mexico have opted for prevention and keep fighting. And mostly the biggest challenge that now in Mexico will be fighting will be inequality. That's a chronic illness among Latin America. Years of favoring private and bank interest have left profound traces, of course, and this will be more clearly after the COVID, and that is even harder here, considering that a political tsunami of 2018 elections. And while this present administration has managed to achieve an increased welfare, but of course there are still many roads to walk, as we have seen in this presentation. I think that's it. Yeah, yep. And thank you for your attention.
Thank you very much.
I unmuted myself. Hello. Thank you, Alicia, and thank you, Lilia, for this very nice overview of the strategy that Mexico has adopted in dealing with the pandemic. We have several people watching this lecture, and they've been writing questions, and I'm sure we'll get you to talk about a lot of other things in response to some of these questions. Let me start by talking about the numbers.
Right.
There are two questions. One is Wall Street Journal, the New York Times have all accused Mexico for not revealing actual deaths. Some say it is three times more than what is being reported. What is your view? There's a similar question um, from Elizabeth, who says Lopez Gatel has been praised for his work by many. However, he recently said that the government has already managed to flatten the curve. According to your presentation, Mexico hasn't quite flattened the curve yet. Can you explain what's your view? Would you like to take these two questions first about the,
Okay, go on, Lilia, the first.
Okay, so yes, so we have like this report of the New York Times and Washington Post saying that they are not reporting the real numbers. That's a fact. I think that's a fact, as Alicia had mentioned it. We're doing this sentinel analysis. That's to put it like more clearly. It's a sample of what's happening in Mexico. So we have the lowest testing rates. So that's, of course, that's a big deal. So the government knows that they don't have the capacity to test, have to provide enough tests. So they are doing this sample of the number of cases. So that's exactly the point of the expansion factor. That's 8. That means that what we see, these report numbers are a sample. We have to consider it by the expansion fact that it's 8, and still we are very not very sure if it is 8 or 12.
But sorry, could I add something to that point? Each system, each model of pandemic model, contagion model, or epidemic models, there are very, very many in the world going on. Others, you have many models for economic growth and so on. But there is, according to the Centinela model, there are publicly and giving all the facts they have collected, from the very small communities to the estados and so on. They have to report, and they are reporting from to the center all the cases, suspicious, confirmed, hospitalized, and deaths. Then the central government or the central health authorities collect those figures and process them and produce the results.
Right.
But there are some time lag. They start running the model at 1 p.m. in order to have the results at 7 p.m. when they publish it in those conferences. So between 12 or 1 p.m. and 7 or so on, they have, in the cities or in the communities, they may have more cases. Then the governors and the mayors and so on, or people just say, well, in my town, we have more than the ones the central authority, Dr. Perez Gatel, produce. Those are facts. Exactly. But there is a time lag, the difference.
I think, just to mention very quickly, I think that the devil is in the details. So the WHO has mentioned it, that this Centinela approach is not the best one, but it's the one we have. For example, the sample that they are taking, the tests that they are making, are mandatory for those that are like very the worst scenarios, the people arriving like in the worst conditions. Those with mild symptoms, they are not getting tested 100%. So we are getting a bias sample. So
I am not tested, but I counted.
They are counted, but yes, it's still. I mean, if you are not getting tested, like there's a big problem in your data, of course. So you have like a bias sample. So and then there's this question about flattening the curve. Yes. So again, so you cannot tell, of course, how many cases are, but this is a sample of the trend. So it seems like it's flattening, but if you check the statistics of today in most of the coronaviruses statistics web page that are available right now, you can see that Mexico is right now it's at the peak. I think that's why they are telling or the Lopez Gatell is mentioning that we are reaching the peak. Not to mention that the graph that we are presenting as are from these two graphs are from the 3rd of May, and the peak should have been the 7th. So that's 7 days ago. Sorry, 2 days ago. So there's of course there's a time lapse difference. So that probably that's why as well.
And flattening the curve is not making it flat.
No, it's reducing the trend.
It's reducing the inclination.
It started slowing down. It's decelerating.
Exactly, changing the trend. Yes. Yes, of course.
Alicia and Lilia, there are two questions. There are lots of questions on the economic
Right.
impacts and so on. But before we go to those, I want to get the others out of our way. There are two questions about the health systems. Elizabeth asks, isn't the reduction of the budget of some health institutions a dangerous thing, especially under the current circumstances? And Carlos Maldonado asks, Mexico is a federation and the health system is not centralized. Therefore, shouldn't we be questioning not just the presidency, but also the local capacities and accompanied interests, the local governments and so on? So,
okay, Lilia, I add something there.
Okay, so the reduction in the budget, there's definitely a problem here. Actually, if we de-aggregate the reduction in the budget, one of the reductions has been in for example, the prevention of HIV and the preventions of chronic diseases. So of course, you have a problem there because those two areas are a big impact in your comorbidity of COVID. So of course, it's a problem there. And I had like this talk with Alicia before, and this change in budget was somehow because there was a lot of corruption in these areas allocating fundings. But still, I mean, if you are fighting corruption, I think that's laudable, that it should be done. But of course, you cannot stop the resources there. It should be continuing going on. So I think that could be a problem as well. That can increase comorbidity, but this will be like just for short afterwards, like in the long run. But because this kind of issues we cannot measure it right now. And I don't know if you want to add something, Alicia.
Well, no, that there are discussions about how far it is true that the reduction, it has been a reduction in absolute terms or just reduction in proportions. And I wonder if it is true that it has been a reduction in absolute terms. And what I know is that sometimes, and I don't want to be like a defender at any cost of the government policies, but in many of the cases, the protest and the confrontation about the scarcity of medicines for VHI and for cancer and so on are mainly political and orchestrated by PAN, and especially PAN, and the main governors against and declaring that they don't have the resources are those from the PAN party. And they have the money, but they are not spending them. So to make it clear, that to clear it of the fog of political concentration, sometimes is difficult, and we have to look at the facts and not only to the social media or the newspapers. But
Right.
it is discussion, and I don't
Right.
say that they are not right.
And then the other question about the reduction in budget and how should we question or like listening to the to also yet to bring an inquiry to each state. I think that's a fact of life. So, for example, this case of scam that was very well known in Mexico about false chemotherapies. They were done with just saline water, so it was not definitely a chemotherapy. That was run by the health system in Veracruz. That's a state government. Uh, of course, it should be like analyzed by each state, but there's also this disparity in states. So, for example, in Oaxaca or in Chiapas, they have a high concentration of population, but they have like low resources. It's not comparable to, for example, in the north, right, where Nuevo León, they have a lot of resources, and although they are like highly populated, they have a lot of resources. So I think, of course, there should be. It's a response by each state, and in another case, for example, now like real time in for the COVID one, Jalisco was trying to get more tests, and they did a false shopping. Like they bought they were scammed, or there was some fraud there, and that was run by the state, not in a federal way. So of course it should be as well that analyzed by state, but somehow this try to reduce inequality at a federal level should also as well impact in these kind of scenarios of state scenarios. I don't know if Alicia, you want to
Thank
add
you.
something.
No, that
Thank
there is
you.
a federal
Yeah.
republic with very independent states,
Okay.
and some are ruled by the Morena movement, others by PRI, and others by PAN.
Right.
And those are not very big. There are minority, but quite strong, some of them.
Yeah.
And
Yeah.
they are taking the opportunity to confront the government within a frame of political confrontation, and being the opposition is in peril, in turmoil, something like in Venezuela, which is dangerous. It is problematic, but they have been unable to structure a response, an alternative. The
Yeah.
PAN is in complete turmoil, very deep crisis. PRI is like being silent on the sideline, perhaps waiting, because there are, Andres Manuel was a former PRI activist and so on. And PRD is destroyed completely in alliance with the far right. So the only man on the political scene is AMLO. That is a difficult question. He's putting the agenda every day at 7 a.m., destroying all the confrontation. Even before the opposition has expressed something, that's incredible. Very, very problematic as well, because you need a proper government, need an opposition. And perhaps, well, now, since he imposed a constitutional reform for the ratification of the mandate in 21, it will have been, they will be those elections or referendum to ratify the effect of the elections. That opened the door for political confrontation in every area of the life.
Alicia, let me now come to the questions related to the economic impact. There are some questions about the informal sector, but before I pose the questions, many of these are from the audience in India. You see, in India, the lockdown that was imposed suddenly has hit the informal sector the hardest. The informal sector workers, particularly migrant workers in the cities, suddenly found themselves bereft of jobs, and that's been the worst and most visible sort of impact of the lockdown. And many
Yes.
of them have been trying to go back home and so on. So there are some questions, trying to understand the situation in Mexico. So on the informal sector, there are two questions here. How does the government identify informal, small or micro enterprises for providing support during a crisis of such proportion? Does the government have lists, contact details? Is there a register where all the workers are registered? Do these enterprises use banking system? How does it work? In what sense are they informal? What is the extent of regulation and the reach that the government has to support these sectors and to support the workers in these sectors? Then there is a question specifically on the slums. Could you please share the status of COVID in Mexico City slums? What sort of support measures are planned to help slum dwellers? Do you see migration of urban poor away from the city? The kind of thing that we see at a very large scale happening in India. Is there something of that kind happening in Mexico? Over to you.
Okay. Well, if I understood the questions, although if not, please correct me. Well, I compared some information about the social distancing in India and in Mexico. And in Mexico, it has been compulsory mainly or only for public sector and and private schools and so on. The others is ask voluntary with very strong social censoring and so on, and with for the very big companies and so on, more compulsory with sanctions and levies and so on. But they are fighting it, putting I don't know the name in legal terms, the amparo. It is sued, asking the judge or the judiciary system to suspend an public law or a decree or something again because it hurts his liberty or wealth or and so on. That's the confrontation. For instance, Electra, as you mentioned me the other time, has put 5 amparos.
Protection, I think.
Protection against a mandate. And it has been, and nobody has, especially Andres Manuel Lopez Obrador or the mayor of the city, of the Mexico City, has made compulsory or legally binding for the micro enterprises and the informal workers not to go to work or not to open the small question. But if people, as me, is restraining of buying are going out, working out, and so on is different. And I think that was considered as problematic attitudes of the president to go on visiting the country, having lunches in small shops on the road and so on. It was a demonstration that the very ones that they need to work because they live day by day cannot close the activity, because the social confrontation can be very strong. Here it is not strange people, just, como se dice, linchamientos.
Rioting? No. Yeah.
Lynch, that the people just take a person and punish them until they maybe died.
Right.
There is I don't. Can you look at the
lynching?
Lynch, okay. Then the Susana distancia. Distance is if you can, please. Restrain if you can. Stay home if you can, please. It's a way of respectful asking, but imposing a social conduct, social discipline. About slums, at least in the Mexico City, I haven't seen many parts of the city, but I have seen in Mexico City at least, but I saw in other areas like Oaxaca and Veracruz, slums, urban slums like in Bogota or in Venezuela, in Caracas, or Cali is another city in Colombia. I think that the public building of social houses was quite large. And migrants to the city, those are mainly from, not mainly, many from rural and very backwards regions, and those are allocated, for instance, in Iztapalapa, but still there are no slums in the way as in Caracas or Bogota, perhaps as well Rio, or the ones that we saw in pictures in Delhi and so on. But in the rest of the country, there are slums. And you have the contradiction. You have about 4 million houses and flats that are not occupied because they were built, they were given to the people in some social programs or privately, and they cannot pay for them, and they are abandoned. Then you have people without houses and living in slums and so on, and 4 million units are empty. As you have people obese with overconsumption and people in food insecurity or suffering by lack of food.
If I may add something very quickly about slums, well, yes, as Alicia mentioned it, we in Mexico City, there are not exactly, or like as we know, like slums, for example, in Delhi, but we do have problems, systemic problems in low income areas with high density of people. So we have, for example, Iztapalapa, or like in the nearby state in Mexico State, in Ecatepec, for example, they have problems with drain. So they, for example, they don't have the drain, or they have a lack of or lack of drain, or they don't have access to clean water. So how could you be fighting COVID, and how can you be washing your hands if you don't have water? And worst is in this time, in this season, usually during March, April, May, we do have a higher hydric stress. That's it. We have less water in the city, so it's a bigger problem there. We have had like some protests in Mexico City. I think if I remember well, if it was in Iztapalapa asking for water. They don't have water. They have had cuts in water, so it's terrible. And on the other hand, of course, we don't have slums, but for example, we have people that had been affected by the big earthquake of 2017. They are living in kind of like slums, and they are struggling. Of course, they don't have water, they don't have a proper house, they don't have a drain, and they are now fighting with COVID. This also has been a lack of response of governmental helps, leaving these people like still living in these insecure areas.
Okay. Now, there are a couple of questions on food security. The food provisioning system in schools was a major program in Mexico. Now, with the schools shut, the food insecurity issue becomes important. What would be the impact of school closures on food security for children? And there's another question. The severe food insecurity faced by Mexico went up from the years after the financial crisis. Can pandemic worsen that situation? And what can be the response to avoid worsening of food insecurity?
Okay, Lilia.
Well, yeah, I think allocating this food system, food vouchers to people, to children mainly, by schools, was a better idea. It allocates it better. Now the government had opened communal dining rooms, dining areas. They are providing free food in some areas, but still they are not well distributed, or as well distributed as you have seen, like when children were going to schools. So it's a big problem there. um During the past government, they impulse I think a nice program in the beginning. Of course, it was a communal dining center. The government provide the main raw materials, and people at the community cook them. Unfortunately, these kind of programs as well were biased, and they had problems, so these programs stopped. And let's hope that this government, at least the ones that they have been running of open and free dining rooms, they let's hope they will still be running, and people will know where they are, because I have been seeing that they're having inequality, where there are ones running out of food very quickly and ones that are like definitely without people, so that could be a problem. um, in the other hand, the problem about the food insecurity, I think the problem with food insecurity in Mexico, it also has to do with how the configuration of NAFTA, or now the TEMEX, it's going on. We are as far as that NAFTA was signed, we began to rely more on imported goods, and of course that had an important impact when you have a change in your exchange rate. That definitely impacts your food insecurity, your food security system. If you are relying on, for example, imported corn, so that's a big problem. Of course, I have been talking with Alicia, and Alicia shares the idea that, of course, this government is focusing more into fostering the internal sector, and fostering the agricultural sector in Mexico. So one of the programs that they are fostering are giving direct transfers to agricultural producers in very poor areas, so you can uh, depend less on imported goods, in imported agricultural goods. I don't know if Alicia has any
Yeah,
comment.
well, the fighting hunger copy like the one installed in Brazil during Lula and before Lula with Cardoso, he had run into problems. The secretary of that branch of the government is in jail because of the big fraud of the program, and now they replace it with, as this Lilia said, with improving the productivity of basic food, grains mainly, amongst the ones that produce those, that are small farmers, Indian population and rural population in very poor areas. And the idea is to be independent and sovereign in food, in basic grains. And it will take time and depends on the change of the price relation with the imports of grains from United States. And I think that it may succeed if the exchange rates continues level without overvaluation. That is one first step, and that may stop migration to the cities, because that is one of the elements of the cities. And the second area is the energy security and energy sovereignty. But those two lines goes in conflict with the NAFTA, with the new NAFTA, very strongly with the new NAFTA. Those are the ones of the many contradictions within the program of the new government. Very deep contradictions. We don't talk about it because it is another conference. But that is the situation. Very low people living on hunger, but insufficient nutritious and insufficient food, and in danger of becoming larger because of the relation with United States agriculture, which is not only very efficient, but highly subsidized.
Alicia and Lilia, there are a couple of questions on the US-Mexico relations and its implications
I
for the
didn't
present.
understand well. What did you say?
There are a couple of questions on the US-Mexico relations and its implications for the current situation. So one is, what is the role of the cross-border travel before mid-April on the increase in number of cases, especially in areas bordering United States like Baja California and so on. The other is,
excuse me, but
yes,
because the relation between what? The first you say, what is
between
the
US and United States and Mexico?
Yeah,
the relationships between. So the first question is about the role that cross-border travel between US and Mexico before mid-April. What was, how important was that for the increase in number of cases in the border states of Mexico? And the other question is, how does the US response to dealing with the crisis in the United States? How does that affect Mexico? I mean, are the United States policies vis-a-vis Mexico, how is that being affected by the US response to dealing with the COVID crisis?
Well, that is a topic I have been working from different areas, the Mexico and USA relations. We don't know. It has not been published how many and how much of the contagious and the cases has been linked with the relations between Mexico and United States. I think that quite a lot, but we don't have the figures quite a lot. And but the suspension since before the contagious and the epidemics, the the traffic between Mexico and United States has been very much hardened because of Trump policies. It was reduced, but still intensive, or was still intensive up to March. It has not stopped completely. Perhaps it is there is a deep connection, but we don't have figures. How many cases are related with people being in contact with infectious persons coming from the United States? We don't know, because as Lilia said, we have not, or Mexico has not the contact following system as has been installed in China, Russia, and so on. We don't know. Second, yes, the influence from the policies instrumented about the pandemic in United States and in Mexico, I think are very strong, and it has been followed by different sectors. For instance, there has been a big pressure from car companies asking the president to open the maquila producers in Mexico that produce and export components and parts for the auto car system factories in United States. And those may be the first to be open. That is one question. There is not only influence, but pressure. Some weeks ago, some car manufacturers from United States sent a long letter to the president asking to open it immediately. And they announced that the softening of the Susana Distancia will go progressively, starting from the municipalities with no cases, and municipalities that are not surrounded by municipalities with cases. But in the productive system, the maquila producers exporting parts and components to the United States will be maybe the first to open. So there is an influence. There's associations of producers, mainly of big producers, that are asking for a new social contract to produce a new government economic plan, are crafted following the ideas put in place in United States to contain the pandemic. So the writers, the writings and the paper, the articles in New York Times, the Washington Post, and so on, reflect that need to influence Mexico to have a different approach, because they don't support primero los pobres. And you have all the time the big ones. For instance, if the big companies suffer bankruptcy because of the contagious, they have the responsibility is amongst the shareholders and the actionists, and not by the government. I will rescue and bail out the mini and the small companies, not the big ones. That is the situation that they don't want to accept. I don't know if you want to add something, Lilia?
Just very quickly about the cross-border traveling. It's very interesting because although we, as Alicia like very importantly point out, we don't know as most of the things right now, but there was a high correlation between the number of the spring break time and the contagious rates. So we had a big rate of contagious in Tijuana, that's a big resort for spring breaks. And we also had a big contagious rate in Quintana Roo at the beginning of the pandemic, where there's another big spring break area. We still cannot tell that for sure, because as Alicia, we don't know, but there's a correlation there. I mean, not causality, definitely. And about the U.S. response, it's very interesting because I think that the systemic discrimination against Latino people in U.S. had a big rate in the problem with a big problem in death rates in U.S. So there has been some denounces that Latino people has been like systemically discriminated. So there people, Latino people are dying in a higher rate in U.S. And as well, there are some rural areas in Mexico right now that they are receiving less inflow of money from people in the U.S. because those familiars living there, some of them, and there has been an increase in, as probably Alicia want to say, there was an increase in the total amount of money sent from U.S. to Mexico, but there are small communities, like isolated communities, let's say, that had received less because, and this has also to do with this high rate of death in U.S.
Nobody can explain why it is the last month was the highest ever month in remittances from the United States. The highest. $4 billion in one month, in April. So we don't know. I have a student that is doing a thesis on the topic of the remittances, and we were wondering yesterday because she's studying both from a psychological point of view, who from those that sent the remittances and those that received the remittances, the strengthening the connection, the love, and so on, the social connections or so. And nobody can explain why it is. They are suffering, they are dying there in United States, they are losing employment, but yet sending remittances. Maybe because they feel that the effect on Mexico will be even harder than the one that they are suffering in the United States.
Finally, there are a couple of questions on the economic sort of support that the government how's the economic policies that the government has used to deal with the crisis. What are the monetary and fiscal responses to the crisis? Fiscal austerity and foreign exchange intervention by Mexico are unusual measures that, different from what most other countries are using. Why were these measures chosen by the government? And Carlos Maldonado has a question for Alicia. What would be your major criticism of the way Mexican government is facing the pandemic? While combating corruption, poverty is the key. What is missing? What do you think?
Can you repeat it, because I didn't understand?
Yeah, the question is, what is missing in the government's strategy to deal with the crisis? What more could have been done? What's your criticism of the government's
Okay, go on, Lilia, first you, and then I.
So the fiscal austerity, yes, I think, as Alicia pointed out at the beginning of the presentation, the thing is, they are trying to reduce austerity. They are trying to play the austerity card because they don't want to increase the total amount of capital influx to the already wealthiest one, the one that had the capital, as we have seen in some research, like for example Piketty research. The ones that have the biggest share of capital are the ones with the biggest amount of money. And so if you increase the amount of money, probably they will get it most of the share. Still, I think there are some problems there in the way that they have implemented this kind of measures. And one of these, a very clear one, it was related to an early question about the cut in health system. Of course, they're having problems. They're having problems with the private sector doing alliances with the health system, and there have been scams, and there have been frauds, and there have been corruption there. But I think that cutting it out of uh, from 1 to 0, let's say, it had had a big repercussion. And I'm afraid that these kind of austerity problems may also have at some point some negative impacts, although the as we have mentioned it before, it works to avoid a disproportional distribution of capital. It may be in the long run, it may have a negative impact as well, because you're reducing the amount of money. I know Alicia has a very interesting perspective about this, but my biggest concern is you are dealing with a big unequal society, a big a one that has people with a very big share of capital. But if you close all of a sudden the flow of, let's say, the money, as thinking as an analogy with water, well, you will have problems, of course. You will reduce the money at the top, of course, but you will also reduce the money, these sparks of money that arrive at the lowest end of the pyramid, the people with lowest income. I think that there may be some problems, but and the direct transfers are trying to fight these systemic problems. But I still, we are lagging behind, and there are going to be some social negative impacts in these kind of reductions. But I'm giving the word to Alicia.
Okay, well, what is missing in the strategy so far being applied if if we consider the containing the contagious, the epidemic one, well, I don't know what is missing. I think that it's okay if we agree with the Sentinel program that is doing okay, and we just wait until the contagious situation disappear, and it will be a long time. It will not disappear immediately, and the only solution is to have a vaccine as soon as possible. And so Mexico has been contributing to that. He has founded part of the effort of the European community, the European Union, to research for vaccines. Yesterday, they said they contributed already $1 million and will contribute more. That is the only solution, real solution, permanent, as with influence. And I know here, and Lilia too, that the vaccination campaigns every year are very efficient. They visit all schools, they put vaccines for influenza and flu and so on, and polio and so on, in the supermarkets, in the metro stations, in schools, and everywhere. That's one question. That's a question of containing the crisis and waiting for permanent solution. I would say that increasing the capacity of testing, increasing the numbers of beds in special for critical situations and so on, and reforming the health system for the long time, and procuring to reestablish the orientation to have more public health, more basic medicine and so on. And another question is to fasten the construction of those 100 universities rural and small towns universities organize, for instance, in the medicine faculties towards the medicines and the kind of care that rural areas needs, and shortening the length of the studies, taking some approach as the medicine faculties in China and in Cuba. 4 years and it's okay, and not 8 years as now. Okay, that's one question. And the second question is it's very difficult to separate the long term and the short term and the long term, because every step you take to make a solution from the short terms make the pave the road for the long term. Now, in the long term, as Lilia said, and I am convinced too, that the concentration of the wealth concentration is the root of income concentration and income inequality. If you don't deal with wealth concentration, you will preserve the income concentration and the income inequality, which is the basis of the health inequality, education inequality, ethnic inequality, and so on. Then I agree, if you don't handle that, you will not solve the inequality problem. And the political problems derived from inequality. One of those is the impossibility to have a really democratic society. That is the contradiction. And Andrés Manuel López Obrador is a reformist within the capitalist system. He's that, even conservative if you want. Because conservatives and right people can propose first the poor, because they need the basis. That's the reality. He's not proposing a revolution. He's proposing a regime change within the system. Yeah. And the system has limitations. Piketty showed some of them. The capitalist system has deep limitations. And we are witnessing since centuries the manifestation, periodical or sporadic manifestations of the contradictions. Now they are very deep. 2008 was another crisis, and crisis as ideas, people have been researching on that. We need different development policies, a different development conceptual. I think that's beyond capitalist system. But that's my idea, my ideology. Perhaps Lilia has a different, and you might as well. But Mexico and Colombia, India, and so on are confronting the United States and the European Union, the limitations of capitalist system and the macroeconomics, neoliberal, neoclassical, and classical economics. I can solve that.
Thank you.
Maybe just praying the Guadalupe Virgin help us to solve.
Thank you. Thank you for this very thought-provoking talk. It's actually very interesting for many of us in India for several reasons. You know, Mexico and India, there are many aspects of economy and society and their history where one can draw parallels, you know, in the large informal sector, the whole sort of history of post-colonial history. There are many parallels that one could draw. But, you know, you have two economies, large, extremely unequal, facing serious constraints in terms of both resources, health systems, and so on. One has a response which is at least moderately progressive, where the government has been trying to be transparent, within the constraints, that on one hand it's not trying to sort of completely radically overthrow the inequalities and so on, as well as being constrained by the health system that's has its own limitations, has actually managed to sort of at least slow down the growth without enforcing a draconian lockdown. On the other hand, in India, we have all of this plus a terribly draconian lockdown, and we have the rises which are significantly higher than that of Mexico. So the comparison is very interesting, and I'm sure our audience who are from India would be thinking about these, and I'm sure this is something that gives us some
I
very
think that
important food for thought. Yeah.
I think that it will be interesting to compare the political
Yeah.
Right.
mean and the political orientation of Madi and Andres Manuel
Absolutely,
Lopez Obrador.
absolutely,
I think so because there are.
absolutely.
I like here, as you could guess from my speeches now. I like him very much, and Lilia knows I am, because it was the only situation acceptable in Mexico.
Yeah,
In,
yeah, surely,
and it
and that's
is,
the difference.
and
The
it is, yes. If you see the ceremony of the 1st of December, when he came into the transfer of power, he made an homage, a humble homage to the Indians,
yeah, yeah,
the Indian population, something very different to Mali,
yeah, yeah, yeah,
towards the
yeah,
Muslims and
yeah,
so on.
yeah, yeah,
But
of
still,
course,
it
yeah,
has the restrictions of the system.
yeah,
I think that it will be interesting and confronting as well the response to the pandemics and so on. I think that it will be fascinating, at least
yeah,
an exercise to do that.
yeah, yeah.
But that
Thank you.
has to be
Yeah,
done by
I think we
political
should
scientists.
we should yeah,
Okay.
take that as work for us to think about. Thank you very much for giving us your morning and taking us through this wonderful talk. Before we leave, I must tell all our audience that we have another fantastic week of lectures starting Monday. On Monday, Jan Kregel is going to be talking to us on why stimulus cannot solve the pandemic depression. On Tuesday, we have Erin Sheldon from Turkey talking to us on coronavirus crisis before and after the new normal. On Wednesday, we actually have a panel from South Africa, four colleagues from South Africa joining us to tell us about what's happening in South Africa. On Thursday, May 14th, we have Professor Jayati Ghosh talking to us on gendered global macroeconomics of COVID-19. On May 15th, we have Walden Bello talking to us on Never Let a Good Crisis Go to Waste, COVID-19 and the Opportunity for Food Sovereignty. And on May 16th, the last lecture of the week, we have Jose Antonio Ocampo telling us about multilateral financial support for Latin America during the COVID-19 crisis. So we have a fantastic week ahead of us. To make it even nicer, I have requested Jayati Ghosh, who's been supporting this entire effort from behind, to come and moderate some of the lectures next week. So I suppose we're going to have her here, not just for her lecture, but also in some of the others to help moderate some of those sessions. So I look forward to have all of you again in the lectures next week. Thank you very much, Alicia and Lilia, for this wonderful
Thank you.
presentation.